Okay, Emily, what do you say to patients or people who are worried that tear trough filler is going to make them look puffy or add to the under eye bags under their eyes?
I say that you absolutely should be worried. This is definitely something you should be concerned about, because if you're using the wrong type of injectable hyaluronic acid, you're using the wrong dermal filler product, you can have horrible, horrible, horrible swelling. It really diminishes trust between the patient and the injector. And I always say you can have swelling in other areas of the face, like your cheeks can swell, your lips can swell, and it's not that big of a deal because it's not quite as noticeable. But when you have swelling in your tear trough area and that under eye area, you can't hide it. It's so noticeable. It's literally all you see when you look in the mirror. So you should be very worried, because this is a really advanced injection technique to treat the tear trough area, and you want to be sure that your injector has a lot of experience, and preferably that they're also a trainer. But I hesitate to really even train my students on tear trough injections until they've been doing all cosmetic injectables, all the basics, for at least 3 years.
And they're ready for more advanced.
Then they're ready for more advanced, because they understand how to handle complications. So in case they do have swelling under the eyes with their patients, they would know how to treat that.
I think that one picture of Kylie Jenner at the Cannes Film Festival last year really scared a lot of people from tear trough, because they figure if she has all the money possible and can still get a bad result, and no one knows that's exactly what she had done, but a lot of people theorize that. But if that's tear trough filler and she has all these resources, how do you avoid that?
Well, first of all, she should come to me.
Everyone should come to you.
Right? And it's, you know, it's funny to laugh about it, but truly, I have a pretty strict rule that I don't do injectables of any kind inside a 14-day window before a big event. So that would have been rule number 1 for me with having Kylie sitting in my chair. I would have said, okay, we know you have this big event coming up. I am not going to touch you with a needle unless you're outside that 14-day window, preferably a month before, and for that very reason. So even the best injectors can still have complications. This is the world of medicine. It is the practice of medicine. It is a medical procedure. And so risk like this can happen. And it's our job as trained practitioners to know when to tell our patients no, and say, at the end of the day, my famous slogan is always the right product in the right patient at the right time. And so I would say that third rule was broken with Kylie. It was not the right time for her to have that procedure.
Or if it wasn't like soon before the event, immediately preceding the event, it could have been the wrong product, something too much volume for what she needed or for her amount of Halloween, right?
Exactly.
Or possibly even placed in the wrong dermal layer, even though she should be going to the best.
Yes, so that leads, so let's just say that rule number 3 was followed and she had plenty of time and no major public events, then it's putting the right product in. And so if you're going to have swelling in the tear trough area and it's a bad outcome on a patient, that means one of 2 things has happened. Either the wrong type of injectable hyaluronic acid was placed in this area, or too much product was placed, or it could have been both. So it's really important that you're selecting the right injectable hyaluronic acid to place in different areas of the face. If I were to open my paintbrush dermal filler drawer back here behind me, I carry every product made in America. And so I'm going to treat a tear trough on a patient. I still might use a different product for a tear trough depending on where the patient is, what decade they're in. Are you in your 20s or 30s? I'm probably going to use one type of product. Are you 40 and up? I'm going to use a different kind of product in your tear trough. Why is that? Well, because we lose collagen and we lose elasticity and the ability to hold on to our products safely without swelling a lot. All of those things play a factor as we continue to age, and so using that right product, selecting the right product is really, really important. And there's only 2 ways that you learn as an injector how to overcome that. One is through education, and the other is through experience.
I love that, because that really does answer all of the theories about, like, well, how could Kylie, of all people, beautiful and all the resources, show up looking like that? And it's right injector, right time, right patient, right product.
It's so funny to me because still, after all these years, we've had cosmetic injectables available to us now for about 20 years, and still, the Golden Globes or, the Met or the Country Music Awards, celebrities somehow aren't getting the memo because we're still seeing people show up with crooked eyebrows and major swelling, and bruises are pretty easy to cover because, well, great concealer and makeup cover bruises, right? But swelling, that's not something you can camouflage very well. And it's still amazing to me that celebrities are still not understanding, do these procedures ahead of time. And it is tough because I treat my share of celebrities and people who are in the public eye, and time is really hard for them. There's really never a good time because they are constantly in the public eye. But these are things that you have to plan for, whether you're a bride or you're going to a high school reunion and you want to look really good. Just remember that 14-day rule. That's the most safe-proof way right there to be sure that you're not feeling self-conscious at an event.
And I think that really comes back to what you said about trusting an injector who will sometimes say no. Because I have to imagine some of these celebrities, maybe they're going to people who don't want to tell them no. And ordinary people, I think you can trust an injector when they will tell you it's not the right time or that's not the right treatment for you.
Yes, absolutely. That's important. It's not about just swiping a credit card. It's making sure that your patient has the best outcome, and that includes having to say no sometimes. It's really important.
You told me no to tear trough filler.
And sometimes, again, a patient will come in and they'll say, well, I think you need to fix the tear trough. And I'll say, well, actually, if I add product to your tear troughs, you are going to have swelling. It's not going to give you the outcome you're looking for. So instead of tear trough filler, we just need a little bit in the cheek to lift and fill that lid cheek junction, and that's a 2-for-1.
Exactly, and I walked in thinking I know so much and I need tear trough filler, and you were able to say no, I don't think so, and suggest medial cheek filler, which I didn't even know was a thing at the time, to smooth that lid cheek junction, and that's actually what I needed instead.
I love using an injectable hyaluronic acid in the cheek contour area. It's one of my most requested techniques for 2024 and 2025. It's still a very popular technique. And what I love about it is I have a 100% satisfaction rate. Anytime you can rejuvenate the apple, that's a 2-for-1 because you're getting a little brightening effect in the cheek area, but you're also closing that hollow that's in the under eye area. And sometimes that can negate the need to then have to have additional tear trough filler placed. It all depends. But I always say this is an art, not an exact science. And so if we can start by correcting, then we can go back and perfect, which is step 2, which sometimes is adding a little bit of tear trough filler. And then our third step is, of course, maintain. So once we've corrected, perfected, then we can put you in our maintenance category. And that's repeating the procedure. I always say do it at least annually. That's truly pausing aging. And then you're really preventing rather than trying to run in and correct every time.
I have one more question for you on this topic, which is, are there people that just, no matter the product or the injector or the timing, just aren't the right candidate for tear trough filler?
Yes, and I would say age is generally a factor. If you're in your 20s and 30s, you have enough elasticity in the skin below the under eye area, you're going to be able to hold your filler. 40s and 50s, I can still use the right product. I tend to use a little bit less. But as we age, you start to get the deep folds, that accordion down under the eye. If I add dermal filler or an injectable hyaluronic acid in the tear trough area, you're either not going to notice a difference at all, just from a cosmetic standpoint, and or you're just going to have a lot of swelling because injectable hyaluronic acid grabs water. It's very hydrophilic. And so if you don't have the elasticity to hold that hyaluronic acid molecule, plus you're adding water weight, you're going to end up with extra bags under your eyes, which are very unsightly. So there is a time when I say no, and if there's a lot of extra folds of tissue under the eye, then I will typically refer that patient out of my office to see a plastic surgeon, because then they're a really good candidate for under eye blepharoplasty, which is extra under eye skin removal. Having that procedure done once you get to that point where you've lost so much elasticity in the skin can take 10 plus years off your face. So in my older clients, I tend to weigh the risks and benefits and discuss those with my patient and say, I don't think that injectable hyaluronic acid is the answer for you, but here's an alternative method that will give you your best outcome.
Well, I love this. I feel like we definitely answered the question of how to avoid under eye filler looking bad, having an injector who isn't afraid to say no and who knows when is the right patient, the right product at the right time with that right injector.
Exactly. Another technique that I like to always address with my patients as well is this is an area where I will use a cannula. And if you do a little bit of research, cannulas are a hot topic out there. Comes and goes. I've seen a lot of trends over my 12 years of injecting. But cannulas are my preferred method of injecting injectable hyaluronic acid in the tear trough area for 2 reasons. One is fewer bruises. And everybody loves that because it's 1 needle poke versus multiple. 1 needle poke, and then I'll use that stainless steel blunt tip cannula, which is not painful. It just feels strange. I always warn my patients, this feels weird, but it doesn't hurt. So fewer pokes means less bruising and less swelling overall. And also my favorite reason is because I get super precise technique placement. That product goes exactly where I want it to and nowhere else. I do hear people talk about filler migration, which is another myth that we will bust on another video. We'll bust that myth. But when I can use a cannula, I can get very, very precise placement with my product, and that leaves everything looking smooth and pretty. And so what I love about my cannula technique in the under eyes, and this is also something I teach nationwide, is that my patient will leave looking porcelain.
Love that. Definitely less pokes, less bruises. Nobody wants to walk out with a black eye. Well, thank you, Emily, for answering some of these most common questions about tear trough filler. If you have any questions about any injectable services, whether it's neurotoxins like Botox or hyaluronic injectables like dermal filler, feel free to comment below and ask Emily.